Good morning. I'm Dr. Christine Selvey from New South Wales Health with the COVID-19 update for Tuesday the 28th of December 2021. Across New South Wales, 95% of people aged 16 years and over have received a first dose of a COVID-19 vaccine and 93.5% have received 2 doses. Of the people aged 12 to 15 years, 81.6% have received a first dose of a COVID-19 vaccine and 78.3% have received 2 doses. There are currently 557 people with COVID-19 admitted to hospitals in New South Wales, with 60 people in intensive care, 19 of whom require ventilation. There were 6,062 cases of COVID-19 reported in New South Wales in the 24 hours to 8 p.m. last night. More than 93,000 COVID-19 tests were reported during that period. Sadly, New South Wales Health is today reporting the death of a man in his 80s from Western Sydney who died at Nepean Hospital. He was not vaccinated and had underlying health conditions. New South Wales Health expresses its sincere condolences to his loved ones. A reminder to everyone across New South Wales to get vaccinated now. If you have not had your first dose, or get your second dose as soon as it is due. We continue to see mostly unvaccinated people in ICU. Thank you to everyone who has come forward for their booster vaccine. New South Wales booster program continues to ramp up, with New South Wales already delivering more than 195,000 booster doses to help keep people safe and increase levels of immunity to COVID-19 across New South Wales. People aged 18 years and over are eligible for a booster. If you're due for your booster but haven't yet booked in, please visit the New South Wales Government website today and make your booking. Masks are compulsory in all indoor, non-residential settings, including for hospitality staff and in offices, unless eating or drinking. QR code check-ins are also compulsory. Hospitality venues, including clubs, restaurants and cafes, have moved to 1 person per 2 square metre rule indoors. There are no density limits for outdoor settings. All settings will remain in place until Thursday, the 27th of January 2022. New South Wales Health advises people to get tested for COVID-19 if they have symptoms, even if only mild, and to self-isolate until they receive a negative result. This public health advice applies to everyone, even people who are fully or partially vaccinated, as well as those who are not vaccinated. Testing capacity in New South Wales is currently under enormous pressure, and the only people who should get a PCR test are those who have symptoms, those who live in a household with a person who has been confirmed to have COVID-19, or those who have been in a venue and New South Wales Health has advised that there has been high transmission. Around a quarter of the people exposed to COVID-19 may still develop their symptoms after 7 days. For the following 7 days, close contacts should exercise caution and not enter a high-risk setting. They should avoid large indoor gatherings and use a rapid antigen test if coming into contact with vulnerable people. Please get tested and stay at home if you have even the mildest of symptoms. Do not visit family, friends, or go to social events if you are unwell. Wash and sanitize your hands regularly. If you do not have symptoms, consider using a rapid antigen test before going out as an additional precaution, particularly if you're planning to socialise in groups or anywhere where it's difficult to socially distance. Again, thank you for your continuing efforts to get vaccinated. get tested, and helping to limit the spread of COVID-19 in our community. Please stay safe. Thank you.